All right, and with that, we will open the floor for questions. First question, what has the response been from frontline workers to receiving the vaccine?
Mark, you want me to take that?
Sure, go ahead.
So on one of our facilities on the first day that we were providing it at that facility, I got there about 5:20 a.m. and there were 50 people in line. So the response has been very, very good. And people have been very respectful of each other. Waiting, we're making sure that we get the people as we prioritize based on state and federal guidelines. It's our ED workers, our ICU workers, our COVID unit workers, and anyone that works in those units as we prioritize who gets the vaccine first. But it's been very good.
Yeah, I would second that and just add that I think for all of us, especially on that first day, and some of you were there on that first day, it was pretty emotional. It was, I know you've heard this said probably too many times, but it really felt like the beginning of the end. And we've had a lot of folks who just are grateful. The number of emails, the number of thank you notes from physicians, from staff, from housekeeping, from everybody who's gotten the, all of our frontline workers are being treated equally. So we're making sure that those at highest risk get the vaccine first. So people are just extraordinarily grateful and hopeful as we go into the Christmas season. It's a good time.
We have several questions that have to do with what's next.
So I'll take that first, Deb, and then you can jump in. So we continue to work with state and federal governments as they are working through Operation Warp Speed to distribute the vaccine to the states and then locally to us. So as we continue to receive allocations from the state, we will continue down the prioritization, working with those frontline healthcare workers first and then expanding it across our organization consistent with state and federal guidelines.
No, I think that's absolutely right. And, as we look at, we approximate how many doses we're going to give in a day that we send out because the vaccine has to be defrosted. And it's a very stringent process we have to go through. So, example, I send X number of doses to a facility and they have people lined up based on the prioritization that Mark just discussed. But what we have found, and I think you've seen on the news, you all are the news, but anyway, you've seen on the news that the vaccine doses are actually higher. We're in some cases getting 6 doses out of a vial instead of the 5 that it's supposed to, which is safe and we can do this. So if I'm just going to use a silly number, if I have 10 doses and I get 2 more, we have alternate lists. So we do not come back with a vaccine. We put every vaccine we draw out of our vials into someone at our acute care facilities.
Specifically questions about the Moderna vaccine. Is there anything you want to address about that?
So across the country, and especially across the state of Tennessee, large health systems like Covenant have been prioritized to get the Pfizer vaccine. And we expect to continue to get the Pfizer vaccine. The rules on this change hourly. And so we will take whatever vaccine is allocated to us, but we anticipate that the Moderna vaccine, based on latest communications from the state, will be focused on rural hospitals that are not part of health systems, that are standalone, and health departments, as well as first responders. So we're working with the state daily, if not hourly. I hate to say 24/7, but it some days feels like it. And getting the information as quickly as we can. But we anticipate the large health systems across the state of Tennessee to continue to be able to receive Pfizer. But if we were to receive Moderna, we can just as easily give that vaccine. It's just the only difference is it's 21 days versus 30 days for the booster shot. So for now, we've received Pfizer and we'll continue to give whatever the state provides us.
Right. And when Mark says the booster shot, the other thing, and we've got a database, so it's very simple for us to track it. You have to have the same vaccine for your second dose. So if I get Pfizer the first time, I have to have Pfizer the second time. Same with Moderna. And it's easily trackable.
We had a question about side effects. Has anyone exhibited any severe side effects so far, and what kind of side effects can be expected?
Go ahead, Deb.
We've given a big number of doses, and the only side effect we've heard about is a little bit of a sore arm.
Right.
That's the only thing that we've seen on the first dose. Mark?
Right. No, absolutely. It's been very safe. It's been very well tolerated. We've not had any significant adverse events at this point, which is consistent with
vaccinated people with histories of anaphylaxis with no issues. I mean, we haven't seen anything yet.
Is Covenant Health using members of the National Guard to help protect and facilitate vaccine distribution? And if so, how? If not, why not?
We have an internal security plan, and we obviously aren't going to share details of our security plan, but we do everything we need to do to make sure that the vaccine is stored safely and protected.
When do you anticipate finishing frontline staff vaccinations?
Well, we are, again, as we are allocated the vaccine, we will give it. We are giving it over a period of time to stagger the doses on the chance of any side effects, particularly with the second dose, as the studies have shown that after the second dose, there can be some mild side effects. So we want to be certain to stagger the dosing. And just logistically, it's a lot of doses. So we're staggering it just to make sure we can do it efficiently, safely, and consistently. Deb?
No, I absolutely agree. We have, the state's given us our time frame that we must get our first allocation in, and we have the plan to complete that vaccination process on time.
Can you address the difference between the first dose and the booster dose in terms of formulation?
They're not booster doses. They are two identical doses. There's dose 1 and dose 2. It's not a booster. They're exactly the same vaccine.
Right.
No difference. It's kind of similar to the shingle shot, how you have to get 2 shingle shots. It's the first dose and a second dose. It's similar to that. Or when we were little and we got our measles and mumps vaccines, that there's a series of doses to get to immunity. That's what this vaccine is like.
What's the status of administering doses at Covenant Health hospitals? When will you be finished? Has everyone been vaccinated? And how long will it take to run out of the allotment?
Well, we're not done yet. And the state continues to give us news daily on how and when we're receiving shipments. So we will distribute the vaccines as they are allocated to us and get them into arms as quickly as we can.
To Mark's point, we have thousands of people.
So we are working through this as expeditiously and safely as we can.
Can you help us understand why it is so important to vaccinate frontline healthcare workers first?
Deb, you want to go?
I think it's really, really simple. These are the people that are, now you'll make me start crying. These are the people that are on the front lines, putting their lives at risk. Good, and each one of them have the potential. We are zealots about our PPE, our protective personal equipment, but there's still, Swiss cheese that, things can happen. We have to protect our people, and that all healthcare workers frontline across the country, because healthcare workers have died. So we have to get our colleagues, our nurses, our techs, our physicians, everyone vaccinated as quickly as possible.
Well said.
What is the difference between this vaccine and a vaccine that uses live or dead viruses, as we've seen in the past?
That's Mark.
So this is a messenger RNA vaccine, as we talked about, mRNA. The big difference is that previous vaccines that have relied on a inactivated virus or an attenuated virus actually take a different virus, like a cold virus or an adenovirus, and they stick a protein on the outside of it that looks like COVID in this case, and kind of tricks your body into believing it should create antibodies. That's part of the reason why some of the flu vaccines aren't as successful as the COVID vaccine. The COVID vaccine, these 2 new mRNA vaccines from Pfizer and from Moderna, and there are other types of COVID vaccines that are coming down the pike that are similar to inactivated virus vaccines, but they're a little more sophisticated. But these first 2, the Pfizer and Moderna, are mRNA vaccines that basically teach your body to make antibodies to a portion of the COVID virus particle. And I'll tell my story that Tanya loves, that it's like your body is taught to make the fin of the shark, or a piece of protein that looks like the fin of the shark. And the fin is that spike protein on the COVID virus. When the whole shark gets into your body, if it ever does, and that would be the COVID virus, your body attacks the fin and the shark dies. So that's how this works. It's different than the inactivated virus vaccines in that the vehicle is different. It still creates an immune response, But the preliminary studies have shown that it's much more successful than the flu vaccines of the past, showing 95% and north of that successful immunogenicity is the big word, making the right antibodies.
Because both available vaccines require second shots to reach full efficacy, is it reasonable to say many or even most hospital workers will be fully protected in January or February?
Well, as I've said many times on this call, as soon as we get the vaccines, we will get them into arms. So a lot of it depends on the supply chain across the country. It's been spectacular to have Operation Warp Speed, Department of Defense, the state, working with us in ways that have just been unprecedented. I emailed some of the state leaders this weekend just to thank them for their responsiveness in this crazy time. I mean, they're answering phone calls, they're answering emails, they're very, very responsive, giving us guidance on a minute-to-minute basis when we need it. So it has been wonderful to help us get it done quickly. And I believe with their help, we'll be able to get it done very quickly. It's like I said, as soon as we can get it, we have created a machine under Debbie's leadership that really has effectively allowed us to get this done very, very well.
We have several reporters who are asking if you can offer some sort of timeline.
There's a Yogi Berra quote about predicting the future that I'll butcher, so I'm not going to go there. But the timeline will be when we get the vaccine. That's the best timeline I can give you. I am optimistic that we will have adequate supplies of vaccine to get it done relatively quickly, but I'm not going to say a timeline here because I just don't know. So we will get it done as quickly as we receive the vaccine.
Governor Lee addressed the state last night. Do you have any response to the things he said? And how are your feelings on mask use at this point?
Well, we've all said all along, the 5 core actions matter. Debbie and I are in separate offices, so we're separated by a wall and 2 doors. So social distancing matters, the social distancing matters, masking matters. Gathering in crowds when we have this level of penetrance of the disease in the community does create additional risk. So, the governor's move to limit the sizes of gatherings was not surprising to me. And I think it reinforces what we have been saying for months. It really hasn't changed what we're doing. We just all need to be more focused on it. As much as we all want to gather with, our friends and our loved ones over the holidays, we've got to be cautious because there's a lot of this disease in our community and in the state of Tennessee. So I wasn't surprised by his comments, but the 5 core actions work. You guys have all heard me say it. They work, and we need to continue to do them.
And I think another important to tag on what Mark's saying, even after people get vaccinated, say we get all of Covenant Health vaccinated by March 1st or whatever day or tomorrow, whatever the day is, we still have to wear our mask and do everything that we are doing right now until we have immunity across the community. This is going to take, and I know Dr. Fauci has mentioned this several times, that it could be third quarter or this time next year when we can just go back to whatever normal is going to be. Is that inaccurate, Mark?
No, that's accurate. We will not attain herd immunity in this first go round. And you've heard me say it a million times. We're all tired. Probably no one more tired than us of working through this. And our teams have been amazing. So we want it to be over as much as anybody. But it's going to take some time. It takes some time for the vaccine to take effect. And we need to celebrate the beginning of the end. It's not the end yet. It's the beginning of the end.
Can you talk about the plan for a potential uptick in cases following the holidays?
Well, we all know we're seeing a spike right now that's very likely related to Thanksgiving gatherings. I think with some of the governor's actions, there may be some decrease in public gatherings with his size of gathering mandate. And I think there's a lot of folks who are seeing the numbers go up who are reconsidering the number of folks they may be getting together with or family gatherings altogether. I think it is wise for everybody to think about that and to certainly be aware of who you've been around and who they've been around. So I do anticipate that if we have the type of gatherings we had at Thanksgiving, it's logical that we would see a spike. I'm hopeful that it will be a muted spike. after Christmas, and I also throw in there, New Year's gatherings make me as nervous, if not more nervous, than Christmas gatherings because they tend to be larger gatherings of people. Again, with the governor's comments recently, that may not be the case, but any type of public gatherings over the holidays will increase your risk potentially of exposure.
How's the staffing situation right now, and how are the staff doing?
So I've been to almost all of our facilities over the last few days. I'm going to use a word that's really important. There is now a huge sense of hope. I said this the other day when we gave our first vaccine, all these things we've been doing, masking, staying apart, is just a barrier. It's not a cure. And what we have now is hope that we have our first defense to wipe out this pandemic, and that's the vaccine. So people are excited, staff are excited. I've given many injections myself, and it's going great.
She's really good at it too, by the way. I've been told. I haven't got mine, but she's really good at it.
Debbie, let's talk a little more about that, because you have been one of the people who is administering these vaccinations over the past few days. What's that been like for you?
Oh, when I see people sitting there and they start crying because, they see hope. I'm going to use that word again, that I can get back with my family. I'm not taking something home that I could spread to my family. I heard, one person, after they got the vaccine, the person looked up and said, "This is for all those that we have lost, that maybe we can stop the loss. This is our first step at stopping the loss." So everyone's excited. It's been great. This is history. I mean, I remember the polio sugar cube back in those days when I was a little teeny tiny person. This is historic. This is going to be life altering in a good way.
From your perspective, is this the worst that it's been at our hospitals for the months of the pandemic? Where are we from your perspective?
Well, and you can see the numbers on the Knox County website. We certainly have seen increased volumes of cases. Our hospitalization percentage has been relatively stable over time, but we're having more people in the community get the disease. So it's the same percentage of a larger number. Our staff are handling it extraordinarily well. We've got a lot of practice, unfortunately. And it's a lot different than it was in the spring when we didn't really know what we were doing because we were all learning on the fly. We have well-oiled machines that are taking incredible care of patients in our hospitals, in our ERs, in our clinics on the ambulatory side, in our home health. It's not just the hospitals. We've got folks across the continuum that are caring for these patients in extraordinary ways. So yes, it's busy. It's been a blessing that we have not seen as much flu in our community this year. Some of that certainly is contributed to by folks who are social distancing and masking, because flu spreads by respiratory droplets, much in the same way as COVID does. So we are seeing a much lower volume of flu patients, and yes, I knocked on wood. But that has contributed to the fact that we've had busy respiratory seasons before. We've had busy flu seasons before that have challenged our staffing and challenged us across the health system. But I think we're doing well in managing this volume.
Yeah, my first year at Covenant Health was 2017, and it was one of the worst flu seasons we have had in a number of years. And we were filled to the brim with flu patients and staff out with flu. So, I mean, this is just a different virus, but we have gone through these cycles before.
We have a question about any information on a reported new strain of the virus circulating in the UK.
Yeah, I've certainly read some of those reports. I haven't read the medical reports yet. I've read the public reports. So I'll make some general comments, not specific to this new strain, but viruses mutate. That's what viruses do. The cold virus does it, the flu virus does it, and it's common. It should be expected for us to see different variants. And I use that word rather than mutations because it's really a variant of the virus. Viruses need our bodies to survive. They can't survive on their own. They need a host. And so in order to stay alive and to propagate themselves, they tend to become a little less virulent, a little more likely to pass. So to see this with, it's 70% likely to pass rate. I don't know if that's really true. I hesitate to use the word contagion yet because, again, I haven't read the studies. But the fact that we're seeing a variant that's changed its behavior a little bit is not surprising to anybody. And from what I have read preliminarily, it doesn't appear that any of those changes to the virus have had any significant impact on the vaccine, called escape from the vaccine. It appears that the vaccine, it's more like attacking the trunk of the tree and not attacking the leaves. The leaves might change color, but the trunk still stays the same. So the vaccine still appears to be very effective. And we anticipate to see variants of this virus. It's new. We're learning about the history of the virus as it happens. So we'll continue to monitor that, and I'm sure the scientific community is going to have a pulse on it.
Hands down, our most popular question has been about the timeline for the vaccines. Let me give you another follow-up question. Is there anything you can share about what you're hearing directly from the state about what's coming?
Well, I don't know what's coming. I don't have that, but I know how many doses that we got last week, and I have 14 days to deliver all of those doses, and they will be.
Right.
That's my reality today. I don't know, because it depends, to Mark's point, what we get next and how much we get, but we have a plan to deliver every one of the doses we currently have within the state's mandated timeframe.
Right. And I wish I had a high degree of certainty of anything happening in the world of COVID, but we all know that literally, as I've said, it's not an exaggeration to say that, things and information we get change hourly. So until we physically have vaccine in our hands, we don't have vaccine.
And we've been planning for 2 or 3 weeks, and we knew the afternoon before that vaccine was arriving on Thursday, and we were ready. So whenever it arrives, we're ready.
As soon as the state provides it to us, we will deliver.
All right, we have just a few minutes left. Are you able to talk about the demographics of COVID patients? Not sure what.
I would refer you to the Knox County website or to the CDC. It has a really good outline of the demographics of COVID patients. It hasn't substantively changed for almost since the beginning. But we are seeing COVID in all ages. It affects the elderly and those with underlying chronic diseases much more severely as a general rule. But we have seen some young patients who have gotten pretty significant illness. So the demographics have not really changed over time. And for specifics, because I can't quote those numbers off the top of my head, I would refer you to both the state's website as well as the Knox County website that does a great job of giving very accurate statistical data.
And we'll reemphasize for those who may have joined us late that we're not giving specific numbers on case counts and things like that because the numbers fluctuate. And you can get that information usually from your local health department. So check their websites for more details on that. All right, I think we're about ready to wrap up. Dr. Brown, Debbie, Honey, do you have any closing comments today?
Deb?
Yeah. Go ahead, Mark.
Well, I'll just close by saying what we open with and close with almost every time. We work with a great team. I can't be grateful enough to the frontline healthcare workers all across our health system on the inpatient and outpatient sides of our health system that are treating and caring for these patients on a day-by-day basis. Literally, as we sit here in this conference, they're out taking care of patients. So we're blessed to have great healthcare in East Tennessee. Covenant Health is grateful and thankful to be part of that team, and we'll continue to provide that level of care after the pandemic. Hopefully, the after the pandemic is very soon.
I absolutely agree with everything Mark said. And I also want to thank each and every one of you today for having the interest to have a conversation with us, because we are dependent on you all as well to get the stories out, to say the vaccine is safe. It is coming. Please take it. Please continue the things that we should be doing, distancing, masking, all those things. And that's where, the health system is very thankful to have media partners to help us give correct and accurate information to the public.
And we have one last question. I think it's a good one to wrap up with, since this is the one that people have the most interest in right now. Everybody wants to know, when do I get my vaccine? Can you run through the phases for which we will be giving the vaccines, who's gotten it so far, where we are in that?
Right. So general statements without getting in all the the individual phases, but frontline healthcare workers and frontline nursing home workers first.
And home health.
And home health, thank you, Debbie. Followed by very closely by all other healthcare workers, our ambulatory partners, the rest of our inpatient folks, et cetera. The federal government and CDC have just recently begun to issue guidance on the public and their recommendations for ACIP, excuse me. And those are relatively new this weekend, so we're going to be evaluating those, et cetera. We don't yet know our role as a health system in public vaccinations. We anticipate most of that will go through the clinics and through the health departments, but this is evolving quickly. If the state asks us to help, we're there. So we will know the timeline in greater detail as it occurs, but that's sort of the general overview.
All right, thank you, Dr. Brown. Thank you, Debbie Honey. And we'd like to thank our members of the media who've submitted questions and joined us for this information session today. Remember that if you do have more specific questions or story ideas after today's briefing, you can always send an email to mediarelations@covhlth.com. Again, that is mediarelations@covhlth.com. Again, thank you, and we hope you all have a wonderful day.
Thank you all.
Thanks.